Hi everybody, so I decided to do my presentation this week on the long-acting injectable paliperidone palmitate, also known as it's the long-acting form of Invega. So what exactly is it? It is an atypical antipsychotic. It is also a serotonin dopamine antagonist, and it is FDA approved to treat schizophrenia and schizoaffective disorder. But it is also used to treat other psychotic disorders, also bipolar, mania, post-traumatic stress disorder, and dementia with behavioral disturbances. How does this medication work? Paliperidone works by blocking dopamine 2 receptors, which stabilizes affective symptoms and reduces the positive symptoms of psychosis. It also blocks serotonin 2A receptors, which enhance dopamine release in certain areas of the brain. This reduces the motor side effects and helps improve affective and cognitive symptoms. What are some side effects? So, the acute blockade of dopamine 2 receptors can lead to side effects like akathisia, dystonia, and Parkinsonism. The chronic blockade of dopamine 2 receptors can lead to symptoms like tardive dyskinesia. The blocked alpha-1 adrenergic receptors can lead to symptoms like dizziness, syncope, and hypotension. And then elevated prolactin levels could occur due to the blocking of dopamine 2 receptors, specifically in the pituitary. So what are some of the benefits of paliperidone? It reduces positive symptoms of schizophrenia. Positive symptoms are hallucinations, delusions, but it can also help improve negative symptoms. Negative symptoms are stuff like aggressiveness, the cognitive symptoms, and the affective symptoms. So though there is not a complete remission of symptoms on this medication, there is usually a reduction of symptoms by a third. And this medication can also help reduce mania. The dosing criteria for this medication is listed below. So there are 3 types of long-acting injectables of this medication: 1 month, 3 month, and 6 months. So the 1 month maintenance dose is 117 milligrams per month. The 3 month maintenance dose is anywhere from 273 to 819 milligrams per 3 months. And then the 6 month maintenance dose is based on the prior 1 month or 3 month dosing. To receive the 3 month injectable form of this medication, a patient must have had the 1 month injectable, the Invega Sustenna, for at least 4 months. And for the patient to receive a 6 month injection, they must have either had the Invega Sustenna 1 month injection for at least 4 months or one cycle of that 3 month long acting injectable. So this medication is not recommended for patients who have not shown tolerability to the oral paliperidone or risperidone. So usually patients trial on that prior to switching over to the long-acting injectable. For initial dosing for this medication, the initial dose is 234 milligrams on the first day. And then on the 8th day, so 7 days later, 156 milligrams is given. And then the maintenance dose will begin 4 months after that second loading dose. So what are some of the societal benefits of long-acting injectables? Long-acting injectables are associated with significant clinical benefits, including a reduction in emergency department admissions and improved medication adherence. There is a higher pharmaceutical cost for long-acting injectables, but the lower medical costs from things like ED admissions and psychiatric hospital admissions help offset the total cost. LAIs are accessible with insurance, and they're often preferred due to the decrease of total healthcare costs. And though individuals living in rural communities struggle with healthcare access, I found a few articles discussing rural pharmacists that provide in-clinic or home visits for LAIs. So I thought that was rather interesting. So these are my references. Thank you guys for listening to my presentation, and I hope you all have a great week.